A North Texas Marine veteran left blind and immobile after a training accident had relied on 24/7 care from the VA. But earlier this year, that care was suddenly slashed. It was an I-Team CBS News story that struck a nerve with many of you at home. And now, as the I-Team has uncovered, the story may be part of a much larger problem affecting veterans across the region.
Just a little bit further, a little bit more. A little bit more, a little bit more.
Nothing in James Carey's life is easy. Not standing, not eating.
What do you think? Is it okay?
15 years ago, Carey suffered a brain injury during a Marine training exercise. It left him blind, immobile, and with dementia. For years, the VA provided 24/7 in-home care. But earlier this year, his family says, without warning, the VA cut those hours. After months of appeals, the Careys were able to get 50 hours a week, but that's still just a fraction of what he had before.
We have to accept the fact that he is in this condition in the first place. Why do we have to keep paying that price every day? Why do we have to beg the VA to give him the benefits he earned?
The I-Team has now discovered he's not alone.
All our client population had, in some shape or form, their hours reduced.
Nagraj Venkataraman runs a home care agency in Denton. He says last summer he started noticing a drop in VA-funded home care hours.
It had a very dramatic impact on me, and I suspect.
For this disabled Vietnam veteran who's also battling cancer, the cuts have been life-changing. The 80-year-old from Denton asked us not to show his face. He's proud of his service, but afraid the VA might retaliate for speaking out. He says he used to get 37 hours of in-home care a week. That covered help getting out of bed, bathing, dressing, even some housekeeping. Now, he gets just 13. With fewer hours and a wife with Alzheimer's, he says he can no longer stay in their home. They're moving into assisted living.
We've been married 60 years, and now I can't help her because I can't get help for me. So, sorry. Just, that's what's hurtful about it.
And you definitely can feel the emotion from that man in Denton, but also the Carey family. Brian New joining us in studio this morning with more on this investigation and what y'all have been looking into for now months. But let's talk about the basics. I mean, why is the VA suddenly making these cuts to folks that were previously receiving this care?
Yeah, so the VA told us that there had been some confusion on the scope of the program. Basically, they told us it was being used for more than it was intended. So we discovered that last summer they started using a new standardized tool, basically a questionnaire, to determine how many hours each veteran can receive. So
what happened when that tool was put into place? What did y'all find happened to the numbers?
Yeah, so when we analyzed the data provided by the VA, what we discovered was that while there were more veterans that are in the program, those veterans were receiving fewer hours. Maybe we can show you some of the exact numbers that we saw. So this was a year ago. So a year ago, last June, there was 37% of veterans in this program were receiving more than 20 hours of care. Let's look at what it looked like last month.
Oh, wow.
11%. So you're seeing while more veterans are in this program, they're receiving fewer hours.
So what was the main reasoning behind making these cuts? Why did they decide, okay, these cuts can no longer be made? You mentioned that scope of services.
Yeah, so they wanted to standardize the program to make sure that it was being implemented, what they said was correctly and fairly across the board. They said that this program, what it's intended for, Madison, is for veterans with complex medical issues to help them with daily activities such as bathing, grooming, light housekeeping. They said it was never intended for 24/7 care.
But as we heard from that man in Denton, I mean, that care then allowed him to also care for his wife of 60 years. So, I mean, this is having significant impacts.
Yeah, the impacts, the consequences. I mean, the program is designed to allow veterans to independently live in their homes. And, you know, as we saw with this Vietnam veteran, that without those extra hours, he's not going to be able to do that.
Yeah, and now having to make choices to move him and his wife into an assisted care facility. Brian, this investigative work obviously having impacts on our community, so thank you for that. If you are a veteran or a caregiver and your in-house care hours were reduced, we do want to hear from you, so you can email Brian and the I-Team at iteam@ktvt.com.